Hello everyone, welcome back to our channel. Today, we'll be diving into the fascinating world of chickenpox, exploring its symptoms, risk factors, and prevention. Chickenpox is an illness caused by the varicella-zoster virus. It brings on an itchy rash with small, fluid-filled blisters. Chickenpox spreads very easily to people who haven't had the disease or haven't gotten the chickenpox vaccine. Chickenpox used to be a widespread problem, but today the vaccine protects children from it. Symptoms. The rash caused by chickenpox appears 10 to 21 days after you're exposed to the varicella-zoster virus. The rash often lasts about 5 to 10 days. Other symptoms that may appear 1 to 2 days before the rash include 1. Fever. 2. Loss of appetite. 3. Headache. 4. Tiredness and a general feeling of being unwell. Once the chickenpox rash appears, it goes through 3 phases. 1. Raised bumps called papules, which break out over a few days. 2. Small fluid-filled blisters called vesicles, which form in about 1 day and then break and leak. 3. Crusts and scabs, which cover the broken blisters and take a few more days to heal. Risk factors. Your risk of getting infected with the virus that causes chickenpox is higher if you haven't already had chickenpox or if you haven't had the chickenpox vaccine. It's extra important for people who work in childcare or school settings to be vaccinated. Most people who have had chickenpox or have gotten the vaccine are immune to chickenpox. If you've been vaccinated and still get chickenpox, symptoms are often milder. You may have fewer blisters and mild or no fever. A few people can get chickenpox more than once, but this is rare. Prevention. The chickenpox vaccine, also called the varicella vaccine, is the best way to prevent chickenpox. In the United States, experts from the CDC report that 2 doses of the vaccine prevent illness over 90% of the time. Even if you get chickenpox after receiving the vaccine, your symptoms may be much milder. In the United States, 2 chickenpox vaccines are licensed for use. Varivax contains only the chickenpox vaccine. It can be used in the United States to vaccinate people age 1 or older. Proquad combines the chickenpox vaccine with the measles, mumps, and rubella vaccine. It can be used in the United States for children ages 1 to 12. This is also called the MMRV vaccine. For some children between the ages of 12 and 23 months, the MMRV combination vaccine may raise the risk of fever and seizure from the vaccine. Ask your child's healthcare provider about the pros and cons of using the combined vaccines. Other people also shouldn't get the vaccine, or they should wait. Check with your healthcare provider about whether you should get the vaccine if you 1. Have a weaker immune system. 1. This includes people who have HIV or take medicines that have an effect on the immune system. 2. Are allergic to gelatin or the antibiotic neomycin. 3. Have any kind of cancer or are getting cancer treatment with radiation or medicines. 4. Recently received blood from a donor or other blood products. Talk to your provider if you're not sure whether you need the vaccine. If you plan on getting pregnant, ask your provider if you're up to date on your vaccines. Subscribe and turn on the notification bell for future updates.